Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a compilation of several earwax removals and also some removal of some trapped water after a patient went swimming and they were extremely pain and distress, and so that's also included in this compilation. So patient one is of a patient who attended with bilateral, fully occluding, dark, medial impacted earwax. We're just commencing with this, their left ear, and I'm just using our standard zone, the suction probe, and we are slowly but surely extracting these wax plugs out of the ear. In total, there were 3 wax plugs, quite sizable, and the patient has got quite a bendy ear canal. You can see we're veering to the right and then back to the left, and this is the third of the wax plugs, and this is more up against the patient's medial. So when we say medial, we mean towards the eardrum posterior, which is the back part of the ear canal. So the medial posterior canal wall, it possibly was also attached to the patient's eardrum. So I'm just mopping up near the entrance. You can see there's quite a few hair strands here, so quite a few cilia. And they are normally located on the outer third of the ear canal, the cartilaginous portion. That's the outer third of the ear canal bears the hair follicles. The inner 2/3 is just literally skin on bone, so there's no hair follicles there, so there shouldn't really be any hairs growing in the inner 2/3 of the ear canal, the bony part. So same patient, just their right ear, probably a bit more adhered to the ear canal wall. There's a bit more keratin that's attached to this wax plug, which is also connected to the ear canal. So just had to work it loose, and then you can see we're bringing it slowly but surely out of the ear canal. It's been there for a while. I think it's been about 4 years, the patient, since they last attended, and they did actually bumped into them in our work car park. They work locally, and they said they're going to book in about a year or two ago, I think, but they've been really busy, all good stuff they've been telling me that's been happening in their lives, and naturally they put the wax to the back of the queue and things are getting sorted, but people have been complaining that the patient's not hearing as well and shouting, so they booked in and we got them sorted. So this is patient 2. This patient has been wearing some earplugs. They are a recent father to a young girl, and they're struggling to sleep at the moment because the child's kind of keeping them awake at night. So the patient decided to put some sleep plugs in, and unfortunately it pushed some wax that's already present in the ear further deeper into the ear, and it really had impacted their ear canal and they weren't able to hear. Has got quite a prominent anterior canal wall. When we mean anterior, we mean the front part where I am now. You can see there's some keratin there. Just got to hover over, and if it doesn't come away cleanly, we're going to come away from that. That's a very sensitive part of the ear. There's some on the posterior canal wall, so there's less nerves on this part, so we're just trying to remove that out of the way, and that skin came away nicely, so we managed to remove that. But the bit that's just lining the front part of the ear canal, we're going to leave that because that's a very sensitive part of the ear canal. So this is patient 3, I think. Yeah, patient 3. This is the patient with trapped water. Now, they went swimming and instantly they felt their ear was blocked. They went to the GP, and the GP couldn't really see the water. And I don't blame the GP because it's very hard to see. You can probably see on the screen. It's very, very hard because naturally water is transparent. And there was just enough water there just to cause a problem. But the patient also has got quite a prominent, what we call anterior recess. This part of the ear canal, while I'm going now you can see the water being suctioned, but this part of the ear canal near the eardrum on the right-hand side, we call that the anterior recess. It's a hidden cave, a hidden alcove. And most doctors wouldn't use an endoscope, they would use an otoscope, so you wouldn't actually even see that. So the doctor prescribed some antibiotics, but explained to the patient it's just water. You can see I've got the water on the anterior recess, but there's now some in the inferior recess. So this dip, this basin near the eardrum, we call that the inferior recess. And again, if you don't have an endoscope, you probably would struggle to see this with a microscope or an otoscope or even the wax scope which I've developed. So I'm just getting into the inferior recess, just suctioning that out. So we're just going to re-enter the ear again. And you can see there's just a little bit of water left. We could have left that, but you can see I've just labelled that just there. So I'm going to go back and see if we can get that. But it's a very difficult part of the ear canal. You can see the ear canal is very inclined. It goes up and then near the eardrum it dips down and curls to the right. And so this patient's ear anatomy does lend itself well to getting water trapped in the ear. So we've discussed water precautions when they're going swimming. I'm just hovering over. I don't want to touch the bony part, and I managed to remove that. So we're just going to go back in. See that eardrum is now water free. The eardrum's slightly wrinkly, and that can happen when you've got water in there. So it was instant relief for the patient. They're very, very pleased. And this is patient 4 now. This patient had the most bendy, narrow ear canal. So it was quite tricky actually to get the suction probe in, because the ear canal is so narrow and bending. You probably have a better perspective of that in a moment. So we're just pulling this wax plug away. So once you're into this, it's fine. But this is the second bend to the left, and on the right hand side where the reflection is, this is the first bend. And it's so bendy. You can see how the ear canal veers off to the right, and it's so narrow. The ear canal's actually collapsed, and this wax plug just got trapped. So I'm having to stretch it wide open. I'm using the endoscope almost like a door stop to keep this open. Hence why the endoscope's quite close to the wax, so you're getting the reflection, because we're having to use the endoscope to stretch this ear open. So it's going to be close to the wax because we're having to position it just past the first bend, which is the cartilage to the right, to stretch it. Again, so I'm stretching the ear open. I'm using the endoscope to keep the ear ajar like a door stop, and then I'm putting the suction probe in, and then we can wriggle this out. So there is still a bit of wax left, but it's not occluding, but we're going to go back in. You can see top part. You can see the eardrum in the distance. So once more, I'm stretching this patient's ear wide open, which then enables me to put the suction probe in. If I didn't stretch this patient's ear open within the endoscope, we wouldn't be able to get this suction probe in, because the ear canal entrance is too narrow at the entrance, and it's really, really bendy as well. So there's just some at the top of the ear canal. I'm just going to tease that away, and you can see there's a little bit of dead skin just anteriorly on the anterior canal wall where the second bend is. And I'm going to use a fine end, I think, just to get access. There we are. This is a smaller suction probe, the fine end. Gauge 18, we call it. I'm just pulling that away. You can see it's just a lot of dead skin. So back into the ear, got to veer really to the right. So this is their second bend where I am now, and this is the very prominent bend in the ear canal. It's almost like a chicane. I'm just trying to get some of this sticky wax out and dead skin. And you can see from that view the ear canal is completely collapsed, narrow. Going to stretch it wide open, put the endoscope into the ear, to the right and back to the left, and that's the patient's eardrum. So it's nice and healthy. Well, I hope you enjoyed that compilation. Take care, keep well, and speak to you soon. Bye.